Hello, my name is Scotty, and I'm the mother of a little girl. Recently, my daughter needed to visit a pediatric ENT, and I would like to share my experience with you and a few symptoms that she had. Dr. Thomas Crews is a board-certified ear, nose, and throat surgeon who has been practicing in the Statesboro area for the past 24 years. He has offices in Statesboro, Vidalia, and Hinesville, and specializes in the treatment of the ear, nose, and throat for children as well as adults. The majority of his patients are children that have a lot of common problems which may be underdiagnosed, unreferred, and untreated. Some of these symptoms are symptoms my daughter experienced, and they are very common in children. These symptoms are the enlargement of the tonsils and adenoids, and they can give quite a number of symptoms that your child may have in which you may not be aware that there's a problem related to the tonsils and adenoids. I'm going to go over a few of these symptoms that Dr. Crews has shared with me. If your child is suffering from any of these symptoms, you might want to contact Dr. Crews and schedule an exam. Does your child snore and struggle to breathe at night? And is it hard to arouse your child in the morning after a long night's sleep? Is your child having multiple upper respiratory infections, requiring doctor's visits but not responding to any medication? Dr. Crews told me if my daughter suffered from those issues, then the problem may be the enlargement of the tonsils and adenoids. Oftentimes, children have common symptoms such as snoring, tossing and turning, pauses in breathing, nighttime cough, sleepwalking, sleep talking, grinding of the teeth, hard to arouse in the morning, and bedwetting in younger children or even older children. In some young children, you can see dark circles around the eyes, hyperactive behavior, moody, cries and whines, aggressive behavior at times, poor attention span, slow growth, lack of weight gain, bad breath, frequent allergy, cold, and sinus symptoms, a constant runny nose, ear infections, problems swallowing food, sore throats, nasal speech, frequent doctor's visits, a lack of response to medication, and many other symptoms. Oftentimes, these children are diagnosed with asthma, recurrent bronchitis, or even pneumonia. Some children who have a lack of sleep or a lack of good sleep will suffer from ADHD type symptoms. They are hyperactive during the day, and during a 1-hour car ride they can fall asleep, just like my daughter did. Symptoms related to older children are hard to get up in the morning, frequently tired, exercise intolerance. Frequently the child is overweight, average or below schoolwork, depressed mood, angers easily, sleepy in class, lies around and avoids strenuous activity, prefers TV and video games to outside activities, hard to motivate, and has a lack of enthusiasm. If your child suffers from any of these symptoms, an exam by a board-certified ear, nose, and throat surgeon like Dr. Crews would be a great idea. Call Dr. Crews today at 912-764-8200. You can also find additional information on drcrews.com or on facebook.com/Crews ENT. I highly recommend Dr. Crews and his staff to anyone who is in need of a pediatric ENT. If you want an informative experience with a doctor who truly cares about your child, call Dr. Crews today and schedule an appointment. He will even give his cell phone number to you for you to call at any time with any questions.